Sadly, the risk of premature death in people with epilepsy is up to 3 times higher than in the general population, with the highest rates of premature mortality found in low and middle income countries and in rural areas. Most deaths that are related to epilepsy can and should be prevented. The same goes for occurrences such as falls, drowning, burns, and prolonged seizures. Bright, just like his name, came up with a bright and innovative idea to help reduce epilepsy-caused injuries and deaths, whilst also increasing awareness about the condition.
The application name is Seizure Assistant, and I came up with that idea after, that exorcism experience at CBU, where I woke up from a seizure and people were exorcising me. And out of that, I thought, what if I could teach these people who are so ignorant about this thing? What if I could teach them how to help me in that moment that I'm having a seizure? And since I was studying IT, I thought, let me merge the two. I'm busy reading around epilepsy and trying to find a final year project. Let me use this as my final year project. And so I built a mobile application that allowed me to just push a button in that moment that I feel that I'm about to have a seizure. And in that moment that I push the button, an SMS is sent to whoever I set as my emergency contact, and they receive that message saying Bright has had a seizure. But they don't just receive that message, it actually gives them my location. So if they have to track me, they'll be able to find me. And the second thing the app does is it will play an SOS sound to basically just get the attention of people around, to get their attention to the phone, so that in that moment that I'm having a seizure, phone is making some noise, they pick it up. Third thing is there. My details, who Bright is, what he is experiencing to say that's a seizure or it's a demon possession, and contacts for the emergency person laid down, and the first aid instructions that they need to follow in order to help me in that moment that I'm having a seizure. For instance, for children who don't have smartphones, for instance, the idea is basically to allow them to wear a neural detector around their ear and have it synchronized with a smartwatch. So when the neural detector detects a seizure, imbalance in the electric activity in the brain, communicates with the wristband, which is the one there, having a SIM card, sends that SMS, and on its screen lays out the first aid instructions.
The World Health Organization says that up to 70% of people living with epilepsy could become seizure-free with appropriate use of anti-seizure medicines. However, these medicines are not readily available for the ordinary Zambian. A recent study found that the average availability of generic anti-seizure medicines in the public sector of low and middle income countries to be less than 50%. This may act as a barrier to accessing treatment.
Medicine is really expensive and really hard to come across, because just a typical monthly medicine expenditure bill for Bright goes somewhere close to 1,500 or something. Imagine that for a person who doesn't work. That's really, really high. And it's not only that you have the money, you have the medicine. The medicine runs out quickly because there's very, very little reach in our country.
An innovation like Seizure Assistant could help to bridge the treatment gap, but it still needs more work before it could be rolled out onto the market.
Right now, I think I'm calling for help from those people who are willing to work with a social enterprise type business model, where people can say, let's roll this thing out, but not with the idea and mentality that we're going to make billions out of this, but run it as a social enterprise such that we're reaching as many people as we can, through the services that we're providing. Government has come forward and made a pledge to, give a 250 grant, and we are still keeping fingers crossed that finally reaches us. I'm still hoping some finances can come my way so that we finalize works on the wearables, that's the smartwatch, the neural detector. The app itself is fully done, and the rollout plan is that the app will be launched without the wearables as we continue, working on these wearables to finalize them so that people can actually afford them. There are many other services and programs that I want to run, such as training of counselors, the advocacy works in public spaces, malls, universities, and all of that. Whatever it is that people are able to help in, let them step forward, and I would love to partner with them and be able to do all these works with them.
Even though there have been other creations designed and produced to deal with reduction of epilepsy-related injuries and deaths, Seizure Assistant is the first of its kind, as it has a whole array of features not found on any other innovation.
In the world, we've got applications that try to detect a seizure when it happens, but if we're talking about Seizure Assistant as a whole, with all the features that it has and everything that it's trying to do, there's no application in the world that has all the features that the application has and that covers epilepsy as a condition to the extent that Seizure Assistant does. Some of the features that you'll find on the application is, I think generally we're just trying to cover two things on the application. Knowledge for the masses and even the person who has it, and also condition management. And the features that do this, one, we've got Seizure 101, which is basically teaching you about seizures. What is a seizure? And what does it look like and all of that. And then two, types of seizures. It shows you various types of seizures with actual images of what the person having that kind of a seizure will look like. Don't worry, these are not actual people, they're just graphs. And then three, we've got a diary, which basically records when a seizure happens. So in that moment that a person clicks a panic button and calls for help, the application records that as a time that the seizure happened. The neural detector also detects a seizure. It records in the diary. These are essential for the doctor, because the doctor will ask, when did you last have a seizure? So we help the person keep track of all that. We've got an inventory which helps the person better manage their medicine. Then we've got reminders as well, which basically just remind the person to take the medicine, and reminders and inventory work in sync. If I add the medicine to the to the inventory, the reminder will need to be set. So if I add, say, carbamazepine, 400 tablets, and then it says set a reminder for carbamazepine, and they say 2 tablets, reminder comes and I said I've taken, it subtracts from the inventory. And if I have maybe just a week of medication left, to remind me to say you only have a week of medication left. And these reminders are not all just coming to the user, but whoever is the emergency contact for accountability, so that if Bright skips, there's somebody to ask, have you taken your medicine? And then away from that, you can find counselors on the application. You want to talk to a counselor, find them right there on the application. Speak to a counselor. You want to attend some meetups where you find other people with the condition so that you can learn and encourage them about something. You'll be able to find the meetups there. You want to attend seminars around epilepsy, you find them right there. You want to find a chat platform where you can complain and vent and do whatever. It's there on the platform. Those are some of the features that are there, and of course there are tips, daily tips on how to better manage your condition. And there's Bust a Myth. There are many myths that we have, and Bust a Myth is a feature that basically gives you cue cards, which will basically be a small card with a myth written on it, and there's a balloon below. You click the balloon, it pops and gives you the truth about whatever myth that is there. So for instance, there'll be a myth like people with epilepsy are dumb. You guys have watched me. Am I dumb? Click the balloon and it tells you the truth. So those are some of the features that are on the application.
The first thing that I heard is that it would remind a patient with epilepsy to take their medication like on a regular basis. That's a very important key, because that will enhance adherence to treatment. When these people take their medications consistently, it will make sure that they'll live seizure-free, which is a very important factor in the management of the condition. We have medications that work for epilepsy, and if people can take them consistently with the help of the app, that can go a long way in addressing this condition. The app also provides education to not only to the patient, but to other people. Like once somebody is having a seizure, it will send out some messages flashing messages on the phone indicating that this patient has a seizure, this is what this seizure is all about, and these are the presentations maybe of this particular condition. That will educate people rather than people starting to think about other things like we had earlier on, people thinking about demons or anything like that. Then the third part, and most important, when somebody is having a seizure, what they need is help. So this app will also provide that information. Who are the contact people for this particular patient? Like maybe some close relatives that can be contacted, like the healthcare provider for this patient, who can be easily reached when that message is circulated there when somebody is having a seizure, and that health practitioner will easily intervene and advise people who are there on what they can do.
In 2015, the World Health Assembly adopted a resolution on epilepsy, WHA 68.20, which urges coordination action at the country level to address its health, social, and public knowledge implications.
Knowledge about epilepsy. This could be to both the patients and also to the general population. We need to educate the population about epilepsy. Epilepsy is just a chronic medical condition if well controlled, just the same as things like high blood pressure or diabetes. We don't discriminate against those people who have those conditions. So should be the same with people with epilepsy. So if we can spread as much information to people about this condition, how it is caused and how it can be prevented, that can help people understand what people with epilepsy are going through.
A person with epilepsy is a person who is normal, just like any other. The epilepsy does not define them. In fact, the one thing that people would even murder you for even saying is calling them epileptic. In that statement, you're almost as if you're almost defining them by their condition. You just call them a person living with epilepsy, the same way you would say a person with malaria